Okay, everyone. It's an honor to have Mr. Ravi Goyal today with us. Mr. Goyal is an experienced and distinguished orthopedic surgeon. He works with us locally here in East Lancashire. His specialities is the lower limb surgery and trauma. And we've asked Mr. Goyal to give you all an insight in what it's like to become a consultant. So, Ravi, it's great to have you with us.
Nice talking to you, Imran, everybody. So my name's Ravi Goyal. I'm an orthopaedic consultant surgeon. And for those who do not know, orthopedics is quite a broad speciality. As you can see, I fix bones. This is a broken knee. Somebody fell over, and we use metalwork. And one of the reasons why I went into orthopedics is we take x-rays. You can see what I do. I can see how my surgery's gone, and it helps me to get better in the future. Here's another patient who broke the leg, high-speed road traffic accident, and we have put a rod inside the bone. And we also affect people who've had arthritis, take out the condition and put in joint replacements. But I don't work alone. I work in a hospital, and within that hospital, we have lots and lots of team workers. We have nurses on the ward, theatre, in clinic. There's medical staff. I've got people who help me, and I help them. These people need training. We've got administration support. We have all these other subspecialties, radiology, pathology, microbiology, and we all work together within this team. And so how did I get into orthopedics? Well, you've had lots of lectures about medical school, and it was important, the previous comment, nobody knows what they're going to do well in advance. And it's all about developing an interest at medical school. You're all intelligent people, you'll get into medical school, and you'll see which of these specialities you like, which one you fit in with. And it's really based on the type of people that you come across. So within orthopedics, I was interested in the fact that here's a broken bone, we can see it, we can fix it, I'm involved with that, and we can make people better. I also found that the staff that I worked with during these placements, they were interesting, they made me feel interested, and they liked me. And so during the whole medical school process, you'll be rotating amongst all these specialities. You really need to engage in each placement, work out what is it that you like about it, what is it that you don't like, what bits will help you make a decision for something that you're probably going to be doing for the rest of your life. And we'll find that your personalities will match with the various specialities. As I've said before, I became interested in what I saw, the staff were interested in me, and I became more interested in the whole thing. And that spurred me to do more reading and to delve deeper into the topic. All these specialities, they are massive in terms of the knowledge required, and nobody expects you to get any of the kind of knowledge at the start. But if you have that interest, that will allow you to maintain a lifelong learning process and a commitment to that speciality. And so you'll see when you go on the wards, there's a whole variety of grades. We know we've got to get a medical degree from university, and then we progress up this tree, foundation years, core training, specialist training, until you get to the consultant surgeon. And we can apply this to all the specialties, medical, surgical, general practitioner, any of them. It's a progression of one's career in your profession. And it's really important to have a little think about how you're going to go on this process. We're not going to know that we're going to do a specific speciality, but we're going to maybe structure ourselves to put ourselves in the best position at each point when we have to make some decision about moving forward. And that's usually some form of job interview for each of the grades. And each of these specialities, they'll have an organization. For us, it's the British Orthopaedic Association. There'll be an umbrella of a surgical college. So for us, it's the Royal College of Surgeons. And just speaking to some of the staff and finding out how they got into the subject, you'll learn about some things that you can join. There's often some affiliation organizations for medical students. They'll have open days, they'll have conferences. And all of these just show that you have an insight into that topic, that you have an interest in it, and that you're making some plan to do that in the future. So it is worthwhile thinking about these when you're in university. And then after you finish your university, you'll get your Bachelor of Medicine and Surgical degree. And that's really your ticket to start your process. And it's really in these first 2 years, your foundation years, you're going to go on the wards, you'll work in 3-4 month blocks, the various specialities, to get a basic understanding of how the hospital works and to really get the insight into the things that you like. During this time, you will have developed some interest in whether it's surgery or medicine and take some professional examinations. These are usually structured with a Royal College. So for surgeons, it's the Royal College of Surgeons, but it could be with medicine, psychiatry, or anesthetics, for example. And then once we have that, we now then have to make a decision on the specialty training. And this really is a structured program, 2 years initially, and then 4 to 6 thereafter, where we become the specialist trainee. And this is probably the first time that we have to get ourselves organized in terms of all the aspects that that specialty is looking for. And it's similar to what you've been going through for your A-levels, trying to get into university. Because nobody is an orthopedic surgeon when they apply to train as an orthopedic surgeon, but we need to show that we have some commitment to that. We've done some research, we've attended some courses, maybe done some presentations. And all of this together will allow us to show that we have the skills and we're made up correctly to move forward in that specialty. We're not looking for a person who knows all the surgery, because that's what we will teach you, but we're looking for someone who will be able to learn and be able to make good clinical decisions and be safe. And so during the specialty training, we'll rotate for a number of years, experiencing hand, wrist, elbow surgery, all of these things, until about year 5, when we'll take our final professional examinations. We'll become a fellow of the Royal College of Surgeons within that speciality. For me, it's trauma and orthopedics. For others, it may be general surgery, vascular surgery, neurosurgery. And during those years, you will then develop your own specific interest within orthopedics. You may like hand surgery. You may like spinal surgery. Once you've passed your exam, you're allowed to take an extra year, maybe even 2 or 3, once you finish the program, to do a fellowship. And this can be done within this country, or some deaneries allow you to go abroad. A lot of people go to Australia, Canada, sometimes America, where you can get that additional year of training in that chosen specialty. And once you've done all of that, you'll get your CCT. For myself, in the 6 years that I was a specialist registrar trainee, I had an opportunity to go to a variety of places. I spent some time in New York looking at knee replacements, Duke University as part of a trauma fellowship, the Mayo Clinic looking at hip replacements, and I did my UK-based fellowship at Preston. And my reasoning for that was it was local. I got to do about 250 joint replacements, and it was during that time that I learned about myself, got my skills honed, and was able to then feel that when I took up my consultant post, I could start that on the right step. I, again, did not know everything, but I felt I was safe. And these things aren't funded by myself. Within orthopedics, we have large implant manufacturers who are happy to provide grants on application to help fund these activities. And so once we've done all of that, we get our certificate of completion of specialist training. You're now added to the register, and then you can start applying for your jobs. And this can be the most stressful time. Not everybody's going to get a job straight away, but there are these fellowships that allow you to do additional year posts once you've finished. And providing you've done your research, you've got your CCT, you have your chosen speciality, you just look into the BMJ, you find consultant posts, through word of mouth as well, and you apply. And I used to think that once you had done your training and you started your job, that was it, you knew everything. And that's not the case. You still are required to continue your learning process. When you start your consultant post, you're not going to start and do the most complex cases. You'll be competent to be able to operate independently, and you will still continue to learn on the job. Over the years, you'll gain further experience. You will be able to go to courses, collaborate with others and your colleagues, and other posts may come along as well. So even though you're a surgeon, you may have further interest in teaching or management experience. And these things are important because the job isn't just about surgery. It's about managing yourself, others, the hospital, and being part of a team. To do all of this, you need to maintain your communication skills and, again, maintain a commitment to a lifelong learning process. So I hope you found that useful. It's very difficult to explain how I got there. It took me 10, 15 years. Things have changed now. The training programs are more structured, more organized. And if you can do the same, you'll have no problems about choosing and becoming the consultant or general practitioner that you want to be. Thank you very much.
Okay, thanks for an excellent presentation, Ravi. We've got a few questions that have been asked about life as a consultant.
Yeah.
One of the questions is, as a hospital doctor, the feeling is that the shifts are tough. You know, there's nights, weekends, on call. What's your experience of that, and how did you feel about it, and rose to the challenge of these kind of unsociable kind of shifts?
I think that's a very important question. When I started as a hospital doctor, the rule was if you stay in hospital as long as possible, at some point you will learn all that information. And so we're trying to acquire knowledge in a fast amount of time, but also in a safe manner. You can't work 72 hours straight as we used to do. And we have to try and split these shifts as part of European working time so that people are safe. And unfortunately, that does pose some problems. You may leave your shift and then the big ankle fracture comes in thereafter. But I think the most important thing is having doctors who are physically and mentally well. The knowledge will come with time. And the biggest anxiety I see is that people feel that they may or may not have all the training that they get, but those things will come. And it is about being safe, and you have to look after yourself, and that's what these new rules allow us to do.
Okay, thanks, Roy. Got another question here. Is it absolutely critical to do research and publications in order to become an orthopedic surgeon?
I think it is. So there are, when we look at the selection process, unfortunately, these are now based on pro formas. There are boxes that need to be filled out. And some of these boxes have high weight attached to it. So you could be a personable guy or lady. You could have done all the right things. You're an effective communicator. But the audits aren't there, or the research is not there. And sometimes we think that research needs to be randomized controlled trials over many, many years and thousands of patients. You can do studies by using statistics, reevaluating other research, and it doesn't always have to be that hard. Within Manchester orthopedic community, they actually invite the trainees to form collaborations. And so by working together, they can fulfill the necessary requirements. And audits, an audit just looks at what we do compared to how we should do it. And simple things, just looking at the drug charts, are we filling them out? We can do a lot of good things quite easily. And again, that's through discussion with usually the registrars to tag yourself onto their research.
Yeah, good. Ravi, there's some questions here about working abroad as an orthopedic surgeon. There's questions about if you wanted to work in the United States or in Africa has been mentioned. Do you know anything about how to go about doing that, or is that possible? If, for example, do your initial training, your medical degree in the UK, and then go off to America?
Yeah, so America is slightly different. You can work there typically in the fellowship year. However, you need to fulfill their requirements. So you need to take their examinations. They used to be called USMLE, now they're STEP. They're costly. They now require face-to-face examinations. It can sometimes be difficult to take those examinations when you're a year 6 registrar, because you're going to have to read up about obstetrics and gynecology and pediatrics. If you have that burning desire, I would suggest strongly you think about taking those exams during your medical school whilst you're learning. You can always go over there and do short fellowships, but they're quite strict in the US. But a lot of my colleagues go to Canada, Australia, and they work there in their 6th year as a fellowship year. But the intention is to always come back.
Excellent. There's a question here about specialty training in hospital. Is it all about cases, doing surgery, or is there kind of lectures and an academic side to it as well?
So within a training program, the very specific rules. So you are attached to a mentor, a clinical supervisor. The hospital will provide usually weekly, for example, orthopedic teaching for the junior staff. You'll have on the job training, and the deanery itself will have their own training program. So within Manchester, the first 4 years, you will go to the teaching on a Friday afternoon, for example, with the goal that after 4 years, you should have enough of the knowledge to then sit your exams. So there are some training programs. There are places I've worked in America where the training programs are intense and vigorous, to the point that they take precedence over the on-the-day job. Here we try to combine them both.
Okay, I think there's a question here, a question about specialities and working hours again. Is it possible? I mean, what's a typical week in the life of an orthopedic surgeon? How do you fit your timetable into the working time directive? Would they be on calls at the weekends every so often, or?
Exactly. So we should think of there's 2 ways. There's the junior rotation, and then there's the consultant. So for me, I do a number of clinics per week. I do a number of theatres per week. I have some administration sessions, and then I have some sessions for myself to do my own reading and my own research, if that's what I'm doing. And within that, there is an on-call. So unfortunately, as a consultant, you have to kind of do all of these things yourself. You do have some help, but time management is an important part of being a hospital doctor. I don't feel that you will find yourself thinking you've got all these things to do and not enough time. And you do have to pace yourself. There are some people who try and do too much. The hospital manager, the clinical director for theatre, all these things. At the end of the day, you're offering a service to your patients, and you actually have to fulfill requirements as a consultant. You have to do some research and audits. So it's all part of the schedule week, which you actually do in your job plan. So you meet with your managers, they set out your timetable, and they make sure that that's all appropriate.
Okay. So as you can see from what Ravi has presented, it is a tough career choice. I mean, I've done no research as a GP, no research, no publications, the odd presentation, but you can see how it compares and contrasts really to a career as being a GP and a career being in a hospital specialty. It is tough. You will be doing nights, you will be doing weekends. You'll have to fit all these things around your family. It's a very kind of tough career choice, but if you push ahead and motivated, it should be very rewarding.
I think you're right. Throughout all of this, if you have an interest in that speciality, then it helps you with your job. If you really do not like it, it'll become very, very difficult. But medicine is so broad, you will find something that suits you and you suits it. And within that, you can balance the work, you can do lots of things, or you can do what your job requires you to do. And generally, most people, if not all, find that balance. There will be some times when it's hard, prior to exams or prior to applications for jobs, and things do get easier. But it's rewarding, and that's why we all do it.